There is a condition quietly affecting 1 in 4 adults in this country right now. Most of them feel completely fine. No pain, no symptoms, no warning that anything is wrong. It's called MASLD, Metabolic Dysfunction-Associated Steatotic Liver Disease. You know it by its older name, fatty liver disease. And in this video, I'm going to explain exactly what it is, how it develops, who's at risk, and what you can do about it. Because here's the one thing I want you to hold on to throughout this entire video. In the early stages, this condition is reversible. That is not a small thing. That is a genuine reason for hope. I'm Dr. Frances Horenstein, a gastroenterologist and the founder of DigestWell Health here in Columbus, Ohio. I see MASLD in my practice regularly, and it's one of the most underdiagnosed, undertreated conditions in gastroenterology today. That's exactly why I want to spend time on it. So let's start at the beginning. What exactly is MASLD? Your liver is one of the hardest working organs in your body. It filters toxins, produces bile for digestion, regulates blood sugar, and processes nearly everything you eat and drink. It is remarkable. MASLD happens when fat builds up inside the liver cells in people who drink little to no alcohol. That last part is important, and I want to be clear about it. This is not caused by drinking, and this is a metabolic condition driven by what we eat, how active we are, and how our bodies process energy. The name changed recently from NAFLD to MASLD to better reflect that this disease is rooted in metabolic dysfunction and same condition but more accurate name. Think of it this way. A healthy liver is deep reddish brown and relatively firm. A fatty liver becomes pale yellow and large, and over time, if the condition progresses, harder and more scarred. When we eat and how we live literally changes the physical structure of this organ. MASLD exists on a spectrum, and where you fall on that spectrum determines how urgently we need to act and what options we have. Stage 1 is simple steatosis, what most people mean when they say fatty liver. There is fat in the liver cells, but minimal inflammation and no significant damage yet. At this stage, the liver is still largely functioning normally, and this stage is very frequently reversible with lifestyle changes alone. Stage 2 is MASH, Metabolic-Associated Steatohepatitis. This is where fat is accompanied by inflammation and actual damage to liver cells. Think of it as the liver being under chronic stress. At this stage, lifestyle changes still make a significant difference, but the window is more urgent. Stage 3 is fibrosis. This is where the liver responds to ongoing damage by forming scar tissue. Mild to moderate fibrosis can still be slowed or partially reversed, but significant fibrosis becomes increasingly permanent. Stage 4 is cirrhosis. Extensive scarring that permanently disrupts the liver's architecture and function. At this stage, we are managing the disease rather than reversing it. Cirrhosis can lead to liver failure and increase the risk of liver cancer. This progression sounds alarming, and I want to be honest with you about how serious advanced liver disease is. But I also want to be equally clear. Most people who have MASLD are in the early stages, and early MASLD is where we can do the most good. So who gets MASLD? The honest answer is a lot of us. The risk factors read like a description of modern life in America. Obesity, particularly abdominal or belly fat, is present in roughly 70% of MASLD cases. Type 2 diabetes or prediabetes is strongly linked. In fact, about 75% of people with type 2 diabetes also have MASLD. High triglycerides, low HDL cholesterol, and high blood pressure, the cluster of conditions we call metabolic syndrome, all increase risk significantly. Diet plays a major role, particularly diets high in added sugars, fructose from sweetened beverages, and ultra-processed foods. Sedentary lifestyle is an independent risk factor, even in people who aren't overweight. Here's what's especially important. MASLD is no longer just a condition of middle-aged or older adults. We are seeing it in people in their 30s and 40s, and even in adolescents. at increasing rates. The shift in how we eat and move over the past 30 years is driving this. Most people find out they have it when their doctor notices elevated liver enzymes, especially the ALT or AST. This is done on a routine blood panel. If your doctor has ever mentioned that you have liver numbers that are a little high, this is worth a conversation. Now here's the part of this video I most want you to hear. In the early stages of MASLD, stages 1 and 2, this condition is genuinely reversible. Not managed, not slowed, reversed. The evidence for this is strong and consistent across multiple clinical studies. Let me walk you through what actually works. Weight loss is the most impactful single intervention we have. Studies consistently show that losing 7 to 10% of body weight leads to significant reduction in liver fat and meaningful improvement in inflammation scores. For someone who weighs 200 pounds, that's 14 to 20 pounds. That is absolutely achievable. Diet matters enormously, and specifically, the Mediterranean diet has the strongest evidence base of any eating pattern for liver health. That means olive oil, fatty fish like salmon and sardines, plenty of vegetables like legumes, whole grains and nuts, and it means reducing the things that feed liver fat directly. Added sugar, sweetened beverages, and ultra-processed foods. Fructose, the sugar found in sodas, fruit juices, and many processed foods, is particularly damaging to the liver because it is metabolized almost exclusively in liver cells and is directly converted to fat. Cutting sugary drinks alone can produce measurable improvement in liver health within weeks. Exercise is powerful, and here's something many people don't know. Physical activity reduces liver fat independently of weight loss. You don't have to lose significant weight to start seeing liver improvement. Both aerobic exercise and resistance training have been shown to improve liver health. The target is 150 to 200 minutes of moderate activity per week. And alcohol. Even moderate amounts worsens MASLD progression. I always recommend limiting or eliminating alcohol entirely in patients with any stage of fatty liver disease. For patients with more advanced MASLD, particularly those with significant fibrosis, there is now an FDA-approved medication called Resdifra. This was approved in 2024. It doesn't replace lifestyle change, but it's a meaningful tool for patients who need additional support. There's also more evidence now for the use of GLP-1s, and this is an emerging trend for patients with MASLD. I want to close with something I say to my patients regularly. The liver is one of the only organs in the human body with significant regenerative capacity. Given the right conditions, it can heal. It wants to heal. Your job is to give it the environment it needs to do that. If you're in Columbus, Ohio, and you'd like to get evaluated, or if you've been told your liver enzymes are elevated and you want to understand what that means, come see us here at DigestWell Health. We offer comprehensive MASLD evaluation, including a FibroScan, and we'll build a plan with you that is realistic and evidence-based. Come book at DigestWellHealth.com. My team will take great care of you. And if this video was helpful, please share it, especially with someone you know who has diabetes, is carrying extra weight, or has been told their liver numbers are off. You could be pointing them toward a diagnosis that genuinely changes the course of their health. Hit subscribe and like this video, and I'll see you next week for more upcoming videos about your gastrointestinal health.